Right. Good evening, everybody, and I'd like to sincerely welcome you all to our Womb Care Clinic webinar. Thank you for everybody that has taken the time to log in and to listen to this particular webinar where we decided as Womb Care Clinic to talk about contraceptions. My name is Paul Mweemba Musoba. I'm a consultant obstetrician and gynecologist. I'm also a fistula surgeon and I'm a fertility specialist from Womb Care Clinic. Can somebody please confirm if I'm audible on the call before I proceed?
Yes, Doc, you're very audible.
All right. Thank you very much. So, contraceptions. There are multiple methods of contraceptions that are out there. And I think they do raise quite a lot of concern for a lot of women when it comes to contraceptions. Which one should I pick? Why should I pick this particular contraception? I started my contraceptions and I started having this particular side effects. So what I'll do is that I'll just run us through various forms of contraceptions that are out there, what you expect when you've started using a particular contraception, and who are certain contraceptions actually meant for? Because I believe that contraceptions are very beneficial for a lot of women, but some might be detrimental to some women based on their medical condition. So this is my presentation layout. Allow me to start with a common case that I see in my clinic. So you've got a 32-year-old woman who has been using Jadel, which is an injectable contraception taken every 3 months, progesterone only, for 1 year. So initially, when she started having this particular contraception, she was having periods of spotting, which was just simply bleeding that is coming when she was not on her period. She came through, counseling was given to say this is part of the side effect that you find with Jadel. And eventually, during her contraception use, she found that her periods had disappeared. So she became amenorrheic and she wasn't seeing her periods. And that even became much more worrisome for her. So she decided to discontinue her treatment. And now she's been off of the Jadel for 1 year and she is trying to conceive and she's not having a baby. So this is sort of a very common picture that we get to see in terms of why women actually come to seek help when it comes to contraceptions. So why do contraceptions matter? First and foremost, these are an integral part of human health and they're integral part of a woman's human rights. So it means a woman can decide to take contraception if she wants or to not take contraception. She has a legal bound on her body to decide what she would love to do. So they're important because they prevent a lot of unintended pregnancy. Statistics show close to 50% of pregnancies are actually unplanned for. So people are living life and suddenly they actually get pregnant. And that's what happens. And now you have to deal with the fact that you're pregnant. So contraceptions help reduce the number of maternal mortalities. Those are women that are dying due to complications of pregnancy. They help reduce the number of unsafe abortions. You find that there are a good number of unsafe abortions that contribute to mortalities. Why? Because a woman was not ready for pregnancy and therefore she decides, okay, this pregnancy that I have, let me find an illegal way or unsafe way of taking it out, and she ends up losing her life. So contraceptions also help with the prevention of HIV. And please note that only the barrier method, which is condoms, can actually prevent this transmission. Every other contraception out there does not prevent the transmission of HIV. What are the goals that somebody should have when they're going to have their contraception counseling? Is that a person's values should be respected during a contraception counseling. That's number one. And it's important that the patient's goals should also be respected. These goals might be because they've got satisfied parity, they've got enough children, and they just want to never have children again. So if that is somebody's goal, then we need to be able to support this. And then we need to support her reproductive autonomy. The decisions that she's making over her reproductive life have to also be supported. So challenges with contraceptions. So the World Health Organization says that, close to 257 million women worldwide have got unmet needs when it comes to contraception. Why is that? Because there's limited access to contraceptions. There's also limited choice in what's happening with the contraceptions that are out there. You find that certain facilities only have one type of contraception. And because of that, a woman is forced to take that particular contraception. And then there's also the fear or sort of the experience of the side effects that come with contraceptions. So every medication out there has its own side effect because why? It's not supposed to be something that is naturally part of our body, if I can put it that way. So there might be some side effects. So there are also cultural or religious opposition to say, why should a woman who's not married be on contraception? Does it mean she's immoral? Why should a man take up a certain method of contraception? Does that mean he's immoral? So there are all those aspects that come into play. So there's also poor quality of services that are available when it comes to contraception. And there are also gender-based barriers that are there. You go for a contraception, you find there's a male over there and you don't want to have the discussion, or you find there's a female as a male and you don't want to have that particular discussion. So when it comes to contraception, they are actually tiered. And the way they are tiered or classified is according to their effectiveness. So there are top tier contraceptions, which have got a failure rate of about 1 in 100. So if 100 women are using that contraception, you find that only one might get pregnant during the first 1 year of use. And then you've got second tier that have got sort of much higher failure rate with a failure rate of about maybe 1 to 10%, somewhere there. And then you've got third tier contraceptions, which have an even much higher failure rate. And then you've got fourth tier, which have got the highest failure rate, if I can put it that way. So what you get with each contraception is that you need to decide, even when you're having your counseling, which tier of contraception you're going to have. There's a very lovely picture that I always use in my consultation room where I show women how the contraceptives actually get to function in terms of their effectiveness. So if you start from the bottom going upwards, you find that you're starting from the least effective type of contraception, such as fertility awareness-based contraception, where a woman simply follows her menstrual cycle for her to say, okay, I am fertile on this particular day, so because I'm fertile on these days, let us not engage in coitus. So you find that that's also a method of contraception, even though the WHO does not quite consider it, because it's got quite a high failure rate. Then you've got these barrier methods, withdrawal methods, and as you keep on moving up the ladder, that's where you start finding your hormonal type of contraceptions, which can be combined or single hormones. And then finally, you've got your implants, your intrauterine devices, and your permanent form of contraception, such as male sterilization and female sterilization. So what can I expect with contraceptions? I always tell, I think, most of the people that I've worked with that I honestly do believe contraceptions are being given to the wrong sex. I believe us males, and I think it's a very unpopular belief that I have, we're the ones that need to be on contraceptions. Why? Because woman just ovulates one egg each month, whilst a man produces millions of sperms. And each of those sperms has got the ability to fertilize. And then you find that the incubation period for a female as well is 9 months. And during that 9 months, she will not conceive again. But the husband or the partner, I always say the damage or what he can do in that 9 months, he can get so many other women pregnant. So that's why I think there's a lot of research that is going on into a male type of contraception. And I actually do look forward to the day when we'll have male contraceptives readily available. So hormonal intrauterine devices, or the famous IUD, as it's called. So with the IUD, there are different brands on the market. Most common brand that we have in our setting is Mweemba, which is a 5 to 7 year intrauterine contraceptive device. So this particular device actually contains progesterone, which is a hormone that is part of a normal woman's cycle, but it contains it in higher doses. And how does it work in particular? Number one, it causes the inside of the uterus where the baby is supposed to sit for it to undergo certain changes that make it unfavorable for the baby to sit there. Number two, it causes a thickening of cervical mucus, and the thickening of cervical mucus will prevent passage of sperm And because there's no passage of sperm, you find that fertilization won't take place. It also causes the tubes which carry the egg for them to sort of be less mobile, if I can put it that way. And because of that, reduced movement of the tubes means reduced movement of the egg itself. So how effective is this? This is one of the most effective contraceptive methods that's out there. So you find that there is a 1 in almost 1,000 chance of a woman actually getting pregnant. So you get 1,000 women, one might get pregnant by the end of 1 year. So what do you expect when you're having an IUD? So what you expect is that it is quite an uncomfortable procedure, but it's not judged as a painful procedure. It requires a speculum to be used and certain instruments to be introduced into the woman's uterus for us to guide this particular device in there. It happens with the hormonal IUD and even the non-hormonal IUD. Once you've started using the IUD, what can a woman expect? And this is the hormonal one. You find that her periods will become very light. There will be a reduction in her menstrual symptoms. So if a woman usually has a lot of cramping, a lot of pain, even as she's having the periods, you find that these type of symptoms are going to reduce because of the hormonal IUD. However, one of the major reasons why women dislike this particular contraception is that it actually does cause intermittent spotting in its first 3 months to 6 months of usage. So it means you have episodes where you have a little bit of a bleed and it can be quite uncomfortable. The bleed is not enough to actually soak your pad, but it can be quite annoying because the woman might have to use panty liners, and it's something that is quite uncomfortable for most women. And for some women, you find that over the 6 months usage, they might end up not seeing their menses. And it can be quite disturbing for some because women always ask me, "Nkalape mina kuisa nomba, where are the periods going?" And when they can't see their periods. So you find that that is part of the hormonal aspect, and that is how it gets to function. And you find that when we look at other contraceptions, such as even just the implant, which is also hormonal based, and even the injectables, which are progesterone based, you find that they also have the same side effects of spotting and also the disappearance of menses. So who is a favorable candidate for this particular contraception? So you find that women that are seeking long-term contraception, so like I said, 5 to 7 years. So this is somebody who's saying, okay, for now, let me hold off. I'm not sure what the future holds, but let me see what happens. So there are also those women that have very painful menses and very heavy menses. They can actually use this particular contraception for them to help reduce the amount of flow that they're having. Women with high blood pressure as well can use this particular contraception. Then there's the non-hormonal intrauterine device, and that is the copper T. So this is sort of the only available sort of non-hormonal reversible contraception that is there that has got a very high effectiveness. So it means less than 1 in 100, actually it's even far much less than that, will actually get pregnant in its first 1 year of use. So this one can last for about 10 years. Others can use it even up to 12 years if you're using this particular one. And how does it get to function? Is that because of the copper that it has around itself, it causes a reaction within the uterus that makes it very unfavorable for any form of implantation to actually take place and even fertilization. So it has got a negative effect on the sperms, it's got a negative effect on the eggs because of the reaction it causes around itself. So this is a non-hormonal type of contraception, and that is why it's loved by most women, because they would still want to be seeing their menses on a regular basis. They would still want to know as well that if I take out this contraception because it hasn't introduced any hormones in my system, it means that I'll be able to conceive as soon as possible. So it's non-hormonal. However, you find that with women with over time use of this particular contraception, their periods might be heavier than they're supposed to be. Why? Because it's causing a reaction within the inner lining of the uterus. And it is this inner lining of the uterus that actually sheds off. And also it gets to distort sort of the blood vessels that are inside the uterus. And that's why it causes heavier bleeding and prolonged bleeding. And it also causes painful menses after a period of time in terms of usage. These painful menses are there more especially within the first 3 to 6 months because there's an adaptation that a woman's body actually undergoes with this IUD there. So once it's removed, boom, you find that a woman returns to fertility quite quickly. So who can use this one? So women that want long-term contraception, but they do not want the hormonal type of it. Women that cannot use hormonal contraceptions for various health reasons. For example, if they've got heart disease, if they've got liver disease, you find that they can use this particular contraception and it is very good for them. And women that would like sort of a longish term contraception, but would like to still conceive at any point in time when they remove it, can actually use this one. Then there are the implants. So the implants, very, very common in our setting. So with the implants, what happens that this particular device is a rod. So there are single rod implants and there are double rod implants that are actually inserted underneath your skin. Usually we place it in the arm that is less dominant. So if you're right-handed, we put it on the left. If you're left-handed, we put it on the right. And once we put this under your skin, this particular one begins to release hormones into your system. So as it releases progesterone hormones into your system, it's going to have the same type of changes that we saw with the IUD, the hormonal one. So it will prevent ovulation from happening, to slow down the tubes, thereby reduce the chances of you getting pregnant. It increases the amount of mucus that you actually produce, so that it can act as a barrier method. And then overall as well, it will cause the inside of the uterus to be less favorable to pregnancy. So with such patients, you find that it is also quite effective. Studies have shown with the usage of this particular contraceptive, in a 3-year period, less than 1 in 1,000 women actually can get pregnant with it. So there are 3-year ones, there are 5-year ones, depending on what you're looking for. So what do you expect? As well, just like with most progesterone-containing contraceptions, you have frequent prolonged bleeding. And this, again, can be quite bothersome. It's been shown that 20% of some of these women, after they've received the contraception, they'll come back to the health facility. Why? Because they're complaining of this spotting and this bleeding. And then another 50% over long-term use will find that they will not see their periods altogether. And that's still the contraception still working. And this shouldn't be something that should worry a woman that much. But because of the failure rate, maybe it's important for you to actually just do a pregnancy test just to rule out pregnancy. So who can use this particular contraception? This contraception is very good. So if a mother has just delivered and she's looking for a form of family planning, this is a family planning that can actually be used for her just in the immediate delivery period. It does not affect breast milk production, so it's very safe. It will not affect the baby even as you're breastfeeding, so it's very safe. Women with high blood pressure as well can use these progesterone-only contraceptions, and women that are looking for long-term family planning can actually use this particular contraception. So if, as a woman, you're satisfied with the contraception itself, meaning at the time when you're having it removed, if you want, another one can actually be placed at that particular period. The goodness with these hormonal implants, you find that return to fertility. And this is something that worries a lot of women. So if I remove it, when will I be able to have a baby? So you find that return to fertility usually happens even within the first month, maximum 90 days for such women. Then we've got permanent contraception. I would say this is the one that is, I think, available for men quite a lot, even though us as men do not take it up because of so many myths that surround this permanent contraception. And one of the biggest myths is that a man always asks, and I get couples asking, will I be able to function properly? Will I still be a man? And the simplest answer that I can give you is a resounding yes. So how does permanent contraception work? So in a woman, what simply happens is that you occlude the tubes so that there's no passage anymore. In a man, you take care of the transportation system, and that is a system that carries the sperms from the testis all the way out. So you just cut it out. And once that is cut out, you find that, boom, no more getting pregnant in that particular period. Major in terms of things to take note of in a man is that once this procedure is done, you're still supposed to be using another form of contraception for at least 3 months. 3 months, why? In order for you to clear out any residue sperms that could have been stored elsewhere. So after 3 months, it's important to do a sperm analysis, and this sperm analysis should be able to confirm that there are no sperms whatsoever in the ejaculate that somebody gets to pass. So in terms of what to expect, it is permanent and there is no more sexual function after any of these procedures. Effectiveness, you find that it is highly effective. I'm sure some people ask, but why is there still a chance of pregnancy? I always say, as long as we're human beings, there will always be a chance of pregnancy. We cannot run away from that. So, in terms of who can have it, we're talking about couples or individuals that are comfortable with their family size. I use the word family size because to start with a family, man, woman, it's not always supposed to be about children. So if they're comfortable with their family size, they can take up this form of contraception. But it is important to tell each couple for individuals to know this is a permanent form of contraception. So it means it is non-reversible. So what happens if somebody would like to have kids after that? Because we've just cut out the passage, you find that there are ways that this can happen through IVF in particular, because a reversal surgery has got very high chances of failure. And then for the tubal ligation or tubal removal, you find that it is quite useful for women that are at a high risk of developing ovarian cancer or other forms of stomach cancers. So if there's a family inclination to developing that, you find that this is one of the methods that is seen to be helpful. Combined hormonal contraceptives or combined oral contraceptive pills are also a form of contraception that is out there. So these ones combine two hormones. They've got estrogen, which is a very, very important hormone in women, and which is the major hormone in the first half of a woman's menstrual cycle. And they've got progesterone, which is the major hormone in the woman's second half of the menstrual cycle. So you find that this one works in particular through estrogen preventing any activity happening in the ovaries that might lead to an egg growing in there. And then also you find that the progesterone part of it will prevent a woman from ovulating, and it will cause all those other changes that I've mentioned before that progesterone actually does. How effective is the pill? So you find that with the pill, the effectiveness is about 91 to 99%. In a perfect world, it's 99%. But because we're not perfect human beings, meaning we get to miss some doses of our pills, and when we get to miss those doses, you find that its effectiveness begins to wear off. So if a woman has missed a day or two of her contraception, the advice is that she still takes the contraception and she still takes the one that she missed. And then what is important is to use a barrier method or another form of contraception for the next 7 days. This allows a buildup of hormones within your system, the ones that you're taking, that will prevent you from ovulating just in case you do ovulate. So what do you expect if a woman is on this? Number one is that there'll be a reduced amount of blood loss that she'll be having with her periods. That's the advantage that comes with the hormonal contraception, because they maintain this regular hormonal level within your system. The cycles will be very regular. So for women that usually complain of irregular cycles, you find that this one actually regulates your menstrual cycles. And then it also reduces the symptoms that come with periods, such as very heavy periods, clots, painful, crampy periods. You find that those will be reduced. For this one in particular, I wanted to say, who cannot use this particular contraception? Who is it not indicated for? So women that have had a history of a stroke in particular, women that have had a history of blood clots in particular cannot use this particular contraception, because estrogen predisposes women to having strokes, to having these clots. So smokers as well cannot use this particular contraception. Women in their postpartum period, that is that 6 weeks period after a woman has actually delivered. Why? Because that period, there's a very high risk of a woman forming a clot, and you don't want to introduce the estrogen in the system. Number two, estrogen has been shown to have sort of a negative effect on milk production. But once milk production has been established, you find that a woman can take oral contraceptions if that's what she wants. Hypertensives as well, you find that this is not recommended for them. So in terms of other combined hormonal contraceptions, there's a patch that you simply apply, and there's also a vaginal ring that you just insert in there. Then there are the progesterone-only pills. So these are pills that simply contain progesterone. And they do have the same effects as the other progesterone-containing contraceptions. However, the challenge that is there with the progesterone-only pills is that you really need to have a tight compliance period. Even just missing one pill for 4 hours finds that it puts you at risk of actually getting pregnant. So if a woman misses a pill for like 4 hours, what's important is that she takes the pill, she uses another form of contraception, ideally barrier method, for the next 48 hours until the progesterone has reached a good level within her system. In terms of what to expect, of course, there'll be that irregular bleeding that comes with it. So who can use it? Hypertensive mothers can use it. Women that are in their postpartum period, women looking for a short-term contraception, and even patients that usually have migraine headaches can actually use it. Then there are the injectable ones. Quite common, very much loved. Why? Because they've got very good compliance periods for some patients where they know every 2 months or every 3 months, I need to go get my injections. However, these ones do cause a worry in some patients. Why? Because they actually do delay a patient's return to fertility. And that is something that is very important. So it's been shown that for some women that get to use these injectable contraceptions, because of the way that they're made, they're progesterone, but they're sort of in this oily form that is slowly released into your system. So they stay much longer in your system. And for some women, they've even gone up to 18 months. That's like from the time that they stopped using them for them to have a return to fertility. So it's very important for women to know that. It will, of course, cause the spotting. It will cause an absence of menses. That is part of sort of the side effects of the particular medication. And for some, it might actually cause them headaches. So who can use this one? So women that are in their postpartum period can actually use it. Hypertensives can also use it. So these side effects that I'm talking about are not cross-cutting. It's not every woman that uses it that will get it. But we have seen that some women can actually get it. And that's why it's important for it to be mentioned. Information is power. So one thing that is very important and worth noting is that this is not an ideal short-term contraception. So if somebody's just looking for something short-term, this is not ideal. Why? Because of how long it takes for some women to return to fertility. I've seen couples come in, they just use maybe one dose of it, and they are having struggles actually getting pregnant just because of one dose. So for women that are looking for that short-term contraception, this is not very much advisable. Then there's the barrier method. The only contraception that actually prevents sexually transmitted diseases. And this is very important to note. So irregardless of whether you're using the IUD, whether you're using your implants, whether you've undergone sterilization, all those other contraceptions put you at risk of developing sexually transmitted diseases. So with the barrier method, that is where the condoms come into play, male and female condoms. Though the male condoms have been shown to be much more effective than the female condoms, maybe because of the easier use that is there for the male condoms. So you find that this is the only one that can prevent HIV transmission, chlamydia, gonorrhea transmission, human papilloma virus, which is the virus that causes cervical cancer transmission. So who can use this method? So you find that women that are at high risk of sexually transmitted diseases are the ones that can use this one. And if you look at these sexually transmitted diseases, the most common sexually transmitted disease is the human papilloma virus. So in short, everybody's supposed to be using the barrier method. So it just simply prevents passage of sperm and other infections. It is highly effective if properly used, with less than 2 to 6% of people that properly use it actually getting pregnant within the first 1 year. People that can't use it are the ones that have got a latex allergy, so that's not suitable for them. Then there are the emergency contraceptions. Very, very important. I think these pills have actually helped so many women out there. So these are taken after having unprotected sex. And you find that the duration of taking them can range between 24 to 120 hours. So that's just 1 day to 5 days. And what is most important is that they work very well if they're taken within the first 24 hours. So the sooner you take them, the better in terms of how they get to function. Unfortunately, these type of contraceptions are not like, for example, the hormonal contraception, the single pill that is there. They will not destroy an already existing pregnancy, because some women have come to the clinic to say, oh my God, I'm pregnant, but I took the morning after pill. What is going to happen to my baby? You find that nothing happens to the baby. Babies grow up very well, doing quite well. So there've been no shown effects onto the baby. So there are the hormonal ones, which are the single pills, which usually prevent or delay ovulation. They change the inner lining of the uterus to make it unfavorable. Then there are the anti-progesterone ones, such as mifepristone, ulipristal. These ones actually change the inside of your uterus. Whatever progesterone changes have happened to the inside of the uterus, they kind of reverse that and they make it unfavorable. Then there's the copper T as well, which can be used for prevention of pregnancy. Yes, so it's not just family planning that can be used over 10 to 12 years. It can also be used in case of an emergency. Somebody has a scare and they go like, you know what, I don't want, and I feel like it is important that I have a family planning. The copper T is something that can be used, and it has got a very low failure rate. So who can use it? Any woman that's at high risk of pregnancy can actually use this emergency contraception. But I repeat, what is important is the duration in which you take these pills. So they are still very effective, even though I've seen a lot of women complain about them, but they're still very effective. So in summary, contraceptions are about choice. So you need to be part of the decision when you're having your contraception. It's also about how well each contraception works and the safety that is available from the contraception and how readily available a contraception is. You don't want to just start something and then in the next 2 weeks they tell you it's gone or it's no longer there and you have to switch and you just keep on introducing different dosages of hormones into your system. You find that that can actually mess up your cycle. So contraception isn't about blocking fertility. That is not the goal of contraception. It is about empowering patients to decide when and how to start a family safely. It's as simple as that. So thank you very much. That was my presentation on contraceptions. Now I think I'll leave it up for some questions, just in case we've got individuals that would like to ask questions about contraceptions and side effects. Any questions? Feel free to type them in the chat, or if you want, you can raise your hand, you unmute and ask your question.
Yeah, I've got a question. That's Mukoka.
Yes, please, Mukoka.
Yes. How many times in a month can one use the emergency pill?
Thank you for that very important question, Mukoka. So the major function of the emergency pill is to prevent ovulation from happening. That is the primary role in which it actually gets to function. So if one is using the pill, you find that they take the pill, it's important that it will work for that duration to prevent ovulation from happening in that particular day. It will delay or prevent ovulation from happening. So what am I trying to say? What I'm trying to say is that if somebody uses the emergency pill today, and because they had unprotected sex, 2 days later, they have unprotected sex again, that emergency pill is not working in their system, and they will have to take another emergency pill. So this pill can be taken, if I can put it, as often as one would like to take it. However, remember that you're still introducing a very high dose of hormones into your system. And what happens with some of the women that do take the emergency pill multiple times within one cycle is that they might have a delay in their periods and they might have a cycle change that might actually happen. So if somebody takes the emergency pill, it is important for them, if that their period has delayed, they do a pregnancy test. Why? Because they might be pregnant, because it still has a failure rate. So there isn't any limit to how many times one can take the emergency pill, but let us limit the emergency pill to being an emergency pill and not as the primary form of contraception that somebody actually uses. Why? Because it will alter their cycle in the way that it actually happens. So I was adding the part where it's not the primary form because there was a question that was asked in the chat about it. And also there's a question about the Chinese pill that people take once a month. Do we have any knowledge on how it works? I do not have much knowledge on the Chinese pill. However, with traditional Chinese medicine, and this is what I say, and it's unfortunate that in Zambia, we haven't researched our traditional side of things. Traditional Chinese medicine has been there for thousands of years. And I believe they have found certain formulations or extracts that are found naturally within the trees that we have, the plants that we have. And that's what gets to work for some women when they take this particular pill. There's no contraception that is 100%. I'll keep on emphasizing that. Even with the traditional Chinese pill, you find that women have still gotten pregnant. But there's still a lot of stories of women that haven't gotten pregnant on it. So in terms of research, I think I'll need to research some more about that and see what are the long-term side effects of women that have actually used the pill. Do we have any other questions about contraceptions? Feel free to type them out in the chat box, or feel free to unmute or raise your hand so that we can call upon you.
Okay, I've got a question.
Yes, please, Chanda.
This is Chanda. I would like to find out, there are some women who when they use contraceptives, it takes long for them to get back to fertility. And the other question is that, my question is it allowed for somebody who has never had any children before to use these contraceptives?
Thank you very much for that question, Chanda. And I think those are the questions I was looking forward to answering. Yeah, so when it comes to contraceptions and return to fertility, it depends on the type of contraceptions. Like I said, among the list of contraceptions that I've talked about, you find that the injectable contraceptions are the ones that have got the longest period from the time when somebody stops to the time when their fertility actually returns. So if you look at the oral contraceptive pills, usually for the oral contraceptive pills, almost a third of the women within the first 1 month will have a return to fertility. Above 90% within the first 3 months will have a return to fertility. So different contraceptions give you different window periods when it comes to return to fertility. So the question is that you need to find out which one would suit you best. So, like I said, I think take-home message is that the injectable ones do have the longest return to fertility, whilst for the others, you find that their return to fertility is actually quite quick. For your second question, Chanda, where you're talking about women that have never had children and using contraception, I believe that is the basis of contraception. So you find that it allows these women, for example, to give themselves a break or to give themselves a chance for them not to have children accidentally so that they can pursue their various goals. And the idea, even as somebody is coming for contraception counseling, is that we need to understand how their menstrual cycle has been. That is very important. So it's important to understand whether they've got regular cycles, are they symptomatic at any point in time during their cycles, so that even as we are giving them advice when it comes to which type of contraception they can use, it suits them according to their menstrual cycle. And we also take in mind that at some point in time, they would love to have children. So contraceptions, whether you've had children, you haven't had children, can still be used because they help prevent you from actually getting pregnant. Thereby, you can pursue your goals and achieve other things that you would want. So I hope that answers your question. There's a question in the sense that What about the withdrawal method? Is it reliable? So this is a very difficult method in terms of it being reliable. When practiced well, 100%, it is effective up to about 87 to most 95% effective. However, you find that with the withdrawal method, a lot of science is being done, and it's been shown to have sort of a negative psychological impact on males in terms of their enjoyment of sexual intercourse. So there's that aspect of it. So it is fairly reliable, but it requires a lot of willpower for it to be done. There's a comment in the chat which says, if I have first unfavorable side effects, like weight loss, acne with a particular contraception, is it enough reason to look for a different type of contraception? 110%. Contraceptions are supposed to be favorable to you. That is very important. So if you are experiencing severe side effects that are not going away, then it's important to change the contraception that you're having. So for example, for some women that develop this sort of acne on contraceptions, you find that there are oral contraceptives that can help with that have got certain hormones in them that can help with the acne and even the challenges that a woman faces. So if you're not comfortable with the contraception that you're on, then it is very much okay to switch your contraception. So that's something that is very important. There's a question saying, is there a specific period during your cycle when the IUD can be inserted, or it can be inserted at any point during your cycle? Thank you very much for that question. When it comes to IUD insertion, ideally, like most contraceptions, it is important to begin them during your menses. Why? Because when somebody uses a contraception during their menses, then we know for a fact that they're not pregnant. When it comes to the IUD insertion, actually it's important to insert the IUD when a woman is actually menstruating. Why? Because during menstruation, the cervix is much softer and will allow instrumentation. These instruments that we're using to place the IUD in there will allow it to have a smoother passage. However, if you do not come during that period in time, and it can still be inserted at any day of your menstrual cycle, as long as you are not pregnant. So ideally, if you want to insert it, better insert it when you're having your menses or when you're just about done with your menses, because at that point in time, cervix is softer, passage is open, and that can be done. There's another question. How can one tell it is time to replace a copper T after several years of use? Do negative symptoms begin after some time? Thank you for that important question. So when you talk about the copper T, remember its lifespan is between 10 to 12 years for some women. So you find that when you reach that period of time, you can actually change your IUD, your copper IUD. However, for some women, they've changed the IUD much sooner. Why? Because you find that maybe they might have severe bleeding that usually happens after about 3 years or so. You find that because of that, they'll say, okay, maybe it's time to change my IUD because it stayed too long. And for these women, we can actually change their IUD if they're experiencing severe bleeding, give them a break period where there's no inflammation that is happening inside their uterus, and then change the IUD. However, when it comes to just changing your IUD, you change it during the precise period. But if you feel as if your symptoms are worsening and they're affecting your quality of life, and despite being given medications that can control the pain, medications that can control the bleeding, then it's okay to change your IUD. There's another question in the chat saying, for contraceptives that delay fertility, there's nothing that can be done or given to a patient to conceive. Is it just to wait for the day when conception happens? Thank you very much for that important question. So you find that women will come through complaining about this delayed return to fertility where they've been waiting. Usually the advice that's there is that you wait a year, minimum a year. So if after a year, you're still not getting pregnant, then you can go ahead and start these particular patients on medication that will help them ovulate, or you try and regulate, quote unquote, their cycles in the way that they're coming. So there still are treatment methods that are available for a woman who is having this sort of long-term effect of these particular contraceptions. Because remember, it is hormonal. So there are hormonal ways in which you're able to fight this and assist a woman for her to actually conceive. There's another question which is saying, what are the other male-dependent form of contraception besides the barrier method, and excluding the permanent ones? Okay. I think I was going to say the permanent ones, but you just excluded the permanent ones. So when it comes to male contraceptions, there are very few contraceptions on the market that actually support males. So like you've mentioned, barrier method is one of them. Permanency is one of them. Unreliable as it may be, withdrawal method is also one of them. So you find that when it comes to hormonal contraceptions, there are none that have been approved on the market as of yet for males to actually use, but there are quite a good number that are under research. So it's quite limited in what's there in terms of options for the males, but it's also important that the males do participate. And I keep on advocating for male vasectomy. I think that is very, very important. I hope I don't get voted out of the men's club for saying that. But yeah, so that's what's there in terms of the male contraceptions. Do we have any other burning questions that I can answer for you? So if there are no other burning questions, I would like to thank all of you that took the time to log into our webinar. I hope this was very, very helpful. We'll upload this recorded version on our YouTube channel so that you can share it with your loved ones, you can share it with your friends, and you can take time to listen to it again just in case there was something that you missed. And I hope this answers some of the questions that people would have had on contraceptions. But if there's still other questions that you wanted to ask, please feel free to ask them on our social media pages on Instagram and Facebook, or even TikTok. That is perfectly fine. In terms of where we are located, we're a clinic that is located in Solwezi. So that is where we are based. And if you'd like to reach out to us, you can always call us on 0761 539 234. And you can always search for us on our social media pages, and always drop us an inbox, and we'll be able to answer some of your questions, and we'll be able to advise you on what you need on your health. So thank you very much, and I wish you all a very lovely week. Please stay tuned. We'll be having our Scars of Womanhood webinar in September, and it's going to be an absolute banger. Have a very lovely week.
Thank you.